hello friends, welcome to my new video. So today I will discuss with you all about a very important topic that we all should know and we all should have a basic idea about the condition as well. So I'm talking about Horner syndrome. So Horner syndrome is a rare neurological condition which is affecting eyelid, pupil, and also one side of the face. So in this picture, you can see that this female patient is, if you closely look at the pupil size of the two eyes, then it is quite smaller than this eye, as well as this eye upper lid is quite lower manner if I compare it with this eye. So it is a case of Horner syndrome that I will come to the next slide that how we came to this diagnosis. Okay, so let's start. So Horner syndrome is a rare neurological disorder which is characterized by the combination of symptoms affecting one side of the face. So here the symptoms like ptosis, that is dropping of the upper lid, miosis, constriction of the pupil, and anhidrosis means absence of sweating. Okay. So to understand the pathophysiology of this Horner syndrome, we should have the basic idea about the sympathetic nerve pathway diagram. Okay. So if I tell about the nerve pathway diagram, there is three kind of nerves taking part in it. There is first order neuron, second order neuron, and third order neuron. First order neuron starts from the hypothalamus. Hypothalamus is actually present at the center of the brain, and from there, first order neuron goes through the brain stem where it goes through the midbrain, pons, and medulla oblongata. Then ultimately it reaches intermediolateral gray column at the level of CA-T2 level of spinal cord. Now, the origin of the second order neuron is from here, the intermediolateral cell column. Now, here in this position or in this site, it gets synapsed with the first order neuron. Now, second order neuron is continuous and it goes through the anterior part of the uh, spinal cord and it reach to the sympathetic canal and ultimately it reach to superior cervical ganglion. So here in superior cervical ganglion, it gets synapsed with the third order neuron. Now third order neuron go through the carotid artery and it reach to skull. Now third order neuron actually divided into two parts. One part go to the internal carotid artery and another part go to the external carotid artery. Internal carotid artery is go inside the skull and then it cross the cavernous sinus. Then ultimately it reaches the ophthalmic division of trigeminal nerve, where one branch of trigeminal nerve is nasopiliary nerve, where it reaches to their nasopiliary nerve and ultimately it reaches to papillary iris as well as it also reaches to molar muscle of the eye. Molar muscle is helping the eye to elevate as same as LCS muscle, but molar muscle helps the eye to be in eyelid in stable position. Okay, so another part that I told you, the external carotid artery through that third order neuron going through it, and it go to the facial nerve, and ultimately it control the sweat gland of the face. Okay, now if any kind of damage happens in this entire pathway, then it lead to some kind of symptoms that we see in Horner syndrome. Okay. Now, here in this, here is the causes of Horner syndrome. Causes can be in three. It can be damage in the first order neuron, or damage can be in the second order neuron, or damage can be in third order. If the damage is happened at the first order neuron, then what kind of damage? First of all, here you can see cerebral vascular accident, that means head injury, multiple sclerosis, encephalitis, meningitis, intracranial tumor, or spinal cord tumor. All these can lead to damage to the first order neuron, and once it is get damaged, then this kind of symptoms can arise. Second order neuron damage site, lung tumor, cervical rib injury, or trauma to the bronchial brachial plexus. And third order neuron damage like carotid cavernous fistula, internal carotid artery, aneurysm, cluster headache or migraine, herpes zoster infection or temporal arthritis. So all these things can also lead to Horner syndrome. Then ultimately, if damage happen in pathway of those nerves, then ultimately it is leading to Horner syndrome signs. Okay. So here in this picture, you can see that this person is having decreased eyelid or lower eyelid in the right eye, as well as the pupil size is quite constricted. Now, what I told you in the nerve pathway, that the nerve which is coming through the necessary nerve, ultimately it leads to the iris dilator muscle. Now, sympathetic nerve actually working to dilate the pupil. Now, because of any damage, the sympathetic nerve impulses are not able to get in the pupillary iris dilator muscle. And the opposite of sympathetic nerve is parasympathetic nerve. It works more manner and ultimately pupil get constricted, right? As well as what I told you that it also work on molar muscle, right? That also help the eyelid to be in the stable position. LPS muscle is the primary muscle to elevate the eyelid, but molar muscle also helps to make the eyelid in stable position. Once the sympathetic nerve pathway are damaged, then it also stops giving innervation to the molar muscle and eyelid is quite slightly droppy manner. As it is also controlling the sweat gland of this face, one side of the face or both sides. But if damage happens, then it is seen in the one side. But this Horner syndrome is very rarely seen in the both side of the face. It is generally seen only in one side of the face, where there is less sweating and also facial expression is less manner, droppy eyelid, mutic pupil. Okay, so these are quite signs of Horner syndrome. Now, how to diagnose it? First of all, history. Assess for any kind of recent trauma, surgery, or symptoms like headache, neck, or shoulder pain, which might point to potential causes. So that is very important. If I tell about the physical examination, then eye examination look for ptosis that I told you about the droppy eyelid, constricted pupil, or decreased sweating in the affected side. And also, you need to look at the facial symmetry. Note any kind of asymmetry such as anophthalmos, there is shrunken or appearance of the eye. Now, in pharmacological way also, we can diagnose it. First of all, I will tell about the cocaine test. So, so the purpose of doing cocaine test to confirm the diagnosis of Horner syndrome. What is the procedure? So cocaine eye drop, 4 to 10% are applied to both eyes. Cocaine blocks the reuptake of norepinephrine, which should cause pupil dilate in normal eyes. In Horner syndrome, the affected pupil will not dilate or will dilate poorly compared to the unaffected side. That will give you sign that the patient might have Horner syndrome. Okay. Another test is epra-chloridine test. So this epra-chloridine test is done to confirm the diagnosis of Horner syndrome as well. So epra-chloridine eye drops are applied to both eyes, and epla-chloridine cause dilation in a pupil with Horner syndrome due to deinnervation supersensitivity. So the affected pupil will dilate and process might improve, while the normal pupil will show minimal response feature. So that is how also we can get an idea that uh, Horner syndrome is present. If because after putting the epleprudine, the pupil dilate or ptosis get improved, then ultimately it is suggesting the patient might have Horner syndrome. And also to know what is the location of the lesion in Horner syndrome, we do this hydroxyamphetamine test. So here, this hydroxyamphetamine eye drops are applied, and if the pupil dilates normally, the lesion is likely preganglionic, that is the first order or second order neuron. If the pupil does not dilate, the lesion is postganglionic. That means the lesion is present in the third order neuron. Also, you can send the patient for CT scan and MRI to identify the structural causes of Horner syndrome, such as tumor, stroke, or traumatic injury. Also, areas of damage like brain or brainstem, if central first order neuron damage is suspected, neck or chest, if the preganglionic, second order neuron lesion is there, and also if postganglionic site is affected, where the third order neuron damage is here, then by doing MRI CT scan, you can detect it very nicely. Now, additional some tests, if I tell you that there is carotid ultrasound. So purpose to evaluate for carotid artery dissection or other vascular abnormality, as well as you can suggest the patient for chest X-ray or CT scan. Here, chest X-ray is actually given to assess for lung tumor, especially can cause tumor, which can affect the sympathetic change, and also send the patient for blood test and lumbar puncture to rule out infections or inflammatory condition is suspected based on the clinical evaluation. Now, if I tell you about the management, so ultimately the management is how you are treating the cause. If the patient having this symptom, treat the cause to treat the disease. So when a patient is diagnosed with Horner syndrome, the treatment approach focuses on several key areas to address the underlying cause and manage the symptoms effectively. Address the underlying cause here, first of all, central lesion, brainstem or hypothalamus, where the first order neuron is getting affected. For patients whose Horner syndrome is caused by issues in the brainstem or hypothalamus, treatment involves managing the primary condition causing the lesion. So this could mean undergoing surgery or receiving radiation therapy, anything to remove the tumor. For stroke or other neurological conditions, for the focus is on appropriate medical management to prevent further damage to that area. Preganglionic lesion damage where the second order neuron is there. So if syndrome is due to trauma, surgery, or tumor affecting the sympathetic nerve pathway, treatment will often involve addressing the specific problem, and this might include surgical repair of the removal of the tumor from that site as well. And post-ganglionic lesion, where it is affecting the third order neuron. So here the condition like carotid artery dissection or cluster headache can cause this type of lesion. So treatment will usually include managing the underlying condition itself. For example, unique medication to prevent blood clot or in case of dissection or providing pain management, etc. And to avoid the symptomatic management process. Even after that, if process doesn't go away, then surgery can be one option for that. So if the patient has significant dropping of the upper lid that affect the vision or appearance, then they can go for surgery. Music, so that is known as constricted pupil. So there is not a typically direct treatment for the mutic pupil. However, treatment of the underlying cause can help to improve the mucus as well. And anhidrosis, here management is here mostly supportive and patients are advised to be cautious about the temperature changes. Now, I told you about the cocaine test and efracloridine test. So this help doctor to confirm the diagnosis of Horner syndrome and assess the function of the sympathetic nerves. So the cocaine test involves using drop to see how people react, while the eflachlorine test helps determine if there is still some sympathetic function remain or not. Also, tell the patient to do the regular eye examination or regular eye exercises, and also patient education is very much important. So it is essential for patients to understand the nature of the Horner syndrome, the potential causes and importance of regular follow-ups visits to your clinic. And if I give you the outlook of this Horner syndrome, it varies widely depending on the underlying cause. So for conditions that can cause that can be treated or managed effectively, such as trauma or certain tumor, there is chance for a substantial improvement. However, when a syndrome is caused by irreversible damage like the stroke or advanced cancer, the focus shifts to managing symptoms, which can enhance the quality of life of the patient. So in every case, the treatment plan is personalized to meet the patient's specific need and condition. So involving a team of specialists involve neurologists, ophthalmologists, and other healthcare professionals is very much important. Okay. So this is how you can manage or this is the management of Horner syndrome. So I hope this video helped you a lot in understanding a lot about Horner syndrome. So the next video will be Pulse.